Return to Africa. People need your love. Return. There is so much to be done. Return.
This week, AEMRN Sierra Leone, in partnership with the Ministry of Health of Sierra Leone and with the Ministry of Foreign Affairs, is implementing important activities. We're supporting diaspora engagement thanks to the Afro-European Medical and Research Network, and with a number of medical professionals coming from all over the world to bring free consultations and free medical surgeries to people in need in remote areas.
Obviously, our healthcare delivery system is not where we want it right now, but efforts like these definitely go a long way in changing the narrative, in helping out to address the many challenges that are confronted in our healthcare system.
Of course, you've gone through all your documentation and you've met all the requirements for you to practice in Sierra Leone. Of course, letters have been written by my colleague, Dr. Senesi, and of course, he has already done everything that's necessary for you to practice in Sierra Leone. So once more, let me welcome you to Sierra Leone.
On behalf of AEMRN officer in charge, Dr. James Manoza, I would like to thank you all for being here today. AEMRN truly appreciates the government's collaboration with specific reference to Ministry of Health, Directorate of Diaspora Affairs, the District Health Management, and the chiefs, and assure people and governments of Sierra Leone AEMRN's highest consideration. Without you, this would not be possible. I would like also to pay a special thank you to the government of Japan, which is the main funder of this specific mission and has funded previous missions in the past.
Happy delegations, success in your performance here and in the mission. I have a general plan to thank you on behalf of the people of the school. Thank you so much.
A lot of people in this environment, they are very poor, and to access medical facilities is a big challenge, especially in rural Africa, in which Kamakwe is one of them. So these are a great opportunity for them to benefit from expertise of medical doctors and other medical practitioners all over the world that have come through this AEMRN project to come to Kamakwe so that they can access free medical facilities. Surgeries will be done, health care delivery will be done, dental will be looked into, gynecologists are on ground, ophthalmologists are also on ground so that they can look into the health challenges of these people.
Morning. Hi, morning. How you do? This time you been delivered? Almost became old now 3 days. You sleep okay? Okay. I think yesterday we can't see you. You even look a bit uncomfortable. The picking, the type of feeder. This is my first time and I'm really enjoying it. You know, it's nice to see what sort of conditions are more prevalent here. And also how we can use, local resources, to manage these conditions, because it's not the same, like working in the UK.
This morning, I just did one case with 3 procedures, one peri-umbilical hernia, and the epigastric hernia, and the left inguinal hernia in one person. So I have to do all these things together because the manpower for them to raise that fund so that they can do such operations. If I do one and leave the one, that woman don't have the money to come back and pay for her surgery.
And 100, okay? That is 1,500. The batch number. The batch is...
I'm evaluating our work, but I'm also monitoring the hospital, the services, where are the gaps, and just helping us better understand what the needs are and how we could help in terms of going back and reporting on those needs and why it's important that we're here helping the community.
Well done, you're very good.
This is my third time in Sierra Leone, and what I've realized is how much can be achieved on each project. So my last project was in Mayamba. I went to a district hospital and I started up a dental clinic, trained up a colleague who was a nurse and now is a dental therapist. So they were able to continue the work that we've done.
I want to thank him for what he did because he has created a lot of impacts in my life. Because since I started practicing dentistry, I know what I have gained a lot. And I know what my communities have gained a lot.
We have our contemporary doctors, our younger colleagues. We have other doctors from also the diaspora. So we learn to share skills, exchange skills, so that at least that one-to-one mentorship, that knowledge sharing and exchange is one of the social legacy we'll be leaving behind. So that when we leave, the doctors, nurses, and healthcare delivery personnel in this hospital and the environment, we learn from them, they learn from us. And that's the greatest impact we think we'll leave.
During the period of COVID-19, the health system has been struggling a lot. So the medical mission is adding value by providing health workers, improving service delivery, and also ensuring that they are working with the local doctors who will stay behind and continue to provide health services, which are much needed, even more so in the period of COVID. We really appreciate this collaboration, working with government and working with the Diaspora Affairs Office, and also working with a network of doctors in Sierra Leone.
They came in when in Puna too, but the way they before small, they don't broke. So for like go to doctor when no sabi but then they risky. So when the specialists they were recently in the camp, I be really happy. And the man really taking time, the white doctor for pull me teeth, he play music, comforts me, like relax, he make I feel at home.
They can't take me. I feel okay now. So I tell you, I thank you. God bless.
I want to say thank you to IOM, and I want to say thank you to the people of Japan and to the Japanese government. Arigato.
Return, Africa, take back your wisdom. Return, you love to Africa.